Grey County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome as a guest Dr. Arra, who is the Medical Officer of Health and the Chief Executive Officer for the Grey Bruce Public Health Unit. Dr. Arra, thank you so much for joining us today. I know you're going to be giving us an update about COVID, vaccine passport, and school starting, everything in between. So welcome and thank you.
Thank you for having me, Carol. Related to the situation of COVID in Grey Bruce in the province, recently for the past few weeks, we've had a low number of cases, quite manageable, an average less than 5 per day, a few days, 0 new cases. And that is directly related to the work of the Grey Bruce case management investigators, the public commitment, the healthcare system testing capacity, and it's a collective effort in Grey Bruce. Currently, we have 0 outbreaks in long-term care, retirement homes, child care, and schools are closed. There was a recent outbreak in a retirement home that was closed earlier today, completely recovered. So that was not an easy finding, considering all the vaccines and all the work that we've done. Nevertheless, it really reassures us that vaccine do work, and the level of robustness in our response to COVID needs to still be there. This outbreak and the recent surge, and again circle back to them, are just another reminder that COVID is with us and it's going to be here for a while. There was a notion in some articles over the past year about eradication, and that is not applicable to COVID. Eradication in public health has certain criteria need to be met, biological and later related to the system and the ability to healthcare system to eradicate. And the smallpox was one of the diseases that was eradicated. You look at COVID, the criteria is not there. And it is also known, the family of corona, known as common cold. And we know common cold stays with humans, and we get common cold once in a while, then we recover, then our immunity goes down, then we get it again. And probably this is the trajectory for COVID, but not at this point. Recently, we've had the practical experience with dealing with the Delta variant in Grey Bruce, similar to Waterloo, and that is definitely a different level of transmissibility. The efficiency in the way the virus, the variant transmits, the Delta variant is significant. And you look at the months of late June, July, we had 4 weeks of repeated surges. Anytime we put out the fire completely, it comes back again. And the average daily cases was around 20 cases per day, which is quite significant, 4-fold increase than the regular average between waves. And that is a clear practical experience with how severe the transmission or how transmissible the virus is. Grey Bruce and Waterloo have dealt with the Delta variant, and obviously coming into the fall, colder months, opening of schools, we anticipate to see a 4th wave, and it's directly related to this variant. During the summer, during the spring, our goal was to reach 75 for vaccines. And we did that late July, early August. And that would have been sufficient to end the pandemic of the other variants. With the Delta variant, unfortunately, the level is 90%. Currently, we in Grey Bruce sit around over 82% one dose and 76% two doses. And that is far from the 90% required for the Delta variant. And if I can mention there the trajectory or the progress of vaccine over the past few months, we used three strategies, Carol. The first one, or all of them were applied at the same time, but the significant one for the first stage was mass immunization, and we used the hockey hubs, and they nicely delivered their objective. By the end of July, especially when the surge happened and we received enough vaccines, we were able to vaccinate half the population in Grey Bruce within 4 weeks. And usually when we reach around the 60-70%, it is the other strategies that can be utilized. And the second one that actually started as early as the first one is the mobile units, the targeted immunization strategy. And during August, it was ramped up, and we've seen clinics across Grey Bruce, close to gyms, close to and parking lots for malls, even on the highway, and wherever it is most accessible to individuals. And there have been clinics related to employers and clinics related to Amish and Mennonite community. And those have been inching slower than we expected. And nevertheless, they're building capacity there, or coverage. Going in this September month, we will have clinics in every school. We're working with school officials to ensure that there is a mobile clinic for every school to ensure the age between 12 and 17 is offered the vaccine at the school. And we will continue with the community clinics, but maybe more targeted for whatever needed at that time. You look at the third strategy for immunization is the traditional vaccine system, which is primary care and pharmacy and public health clinics, whether it's in the health unit or in different locations. And this is similar to influenza vaccine. And this will be the sustainable rollout of vaccine going forward. We looked at different directions recently from the province to up the vaccine and to be prepared for the fourth wave. And I do see that the variety of approaches, whether it is the upping the advocacy for more vaccine or utilizing policies to encourage employers and different sectors to have policies to require vaccine from individuals, or most recently, the vaccine passports. And you can see the increase in intrusiveness. It's the principle of least intrusive in public health that we use. And I do believe that the province and the Chief Medical Officer of Health's office have been following this principle very appropriately. If education achieve the goal, there is no need for advocacy, and if not, we need advocacy. If not, we need policies. And I realize it might be perceived and might be the application of it contentious in the community, and you've seen people sometimes protesting about it, about the right. But truly, if you look at the subject itself, and I know I was providing an update, but now I went into different aspect of it, but it all comes back to what we are seeing in our area as well. Concerned citizens who are voicing their opinion about the right not to get vaccinated. It's worth mentioning any of these policies, including the vaccine passport, does not take the right of choice. Any person can still have the choice to say, I don't want to be vaccinated and I don't want to use the passport. And we need to balance in the ethical and legal discussions by experts who know about this more than I do, different rights. There are a right of the employer or individuals to attend activities where everybody's vaccinated, where it is safer, higher level of safety. It is the right and the obligation of the employer to protect their employees in their workplace. And definitely it's the right of the individual who want to make that choice about getting the vaccine or not. And if the activity is going to a restaurant, they definitely have the right not to go to that restaurant, not to use the passport. So in this bigger picture and the multiple approaches and the need to up the vaccines to 90% to hopefully reduce the transmission of the virus, allowing our kids to go back to school and have that social experience, educational experience, allowing our businesses to stay open, avoid a lockdown. It is emotionally charging experience for many people. People are upset, there is hardship, but it is important to remember for all of us that it is the pandemic that's causing this hardship. It's not the decision maker, it's not the policy itself, it's not the business who's using the vaccine passport or not. And we are at a juncture that I really didn't hope we're going to be in. As if you remember, every time we talked, I talked about ending the pandemic when we reached the 75%, and that is true for the variants that existed at the time. And there was always the caveat in whatever I said, that there was always the potential for a variant that's more of transmission, and obviously we are there right now. I am confident, again, that in Grey Bruce, the collective of us, the society, the societal we will be able to mitigate the fourth wave. And I know it's not going to be easy. There is fatigue. People are tired. Staff are tired. The hospital staff and the healthcare system are tired. And how can we find enough energy in us to actually go that further, this last mile to hopefully mitigate this fourth wave and have enough vaccines to prevent the circulation. I'll stop there, Carol. I answered more than just the update, but it's all part of it.
It's all so important, and I'm finding it quite relaxing just to sit here and not have to ask questions because you've got so much information. But as I told you before we started, I might have a few. So when you say we hope to mitigate the fourth wave will happen. Your goal is to reduce the curvature, the impact of the fourth wave. That's what you're really saying, correct?
Correct. My hope is to mitigate it, to prevent that surge. Like, obviously, if we go to a complete lockdown, we are not going to have the challenge to our hospital capacity, but we know realistically the public are tired. And can we mitigate by increasing the vaccine level and maybe having some restrictions, like using masks for a bit longer, maybe stage 2 level restrictions. And in that case, there will be some increase in cases, but it's not going to be severe enough to actually stall our hospital system.
Okay. So I recall in our earlier interviews, you used a phrase, be kind. And you're right that people are tired. Tempers are short. People are frustrated. When you have the pushback now against the vaccine passport, and those people who say, let's just do what we need to do to open things up, it's a very delicate dance between being respectful and allowing the larger society to be able to move forward. Do you have any words of wisdom other than what you've already shared about how we can go forward? Because there is no doubt people will voice their opinions. Demonstrations may or may not happen. What advice can you give us around our health, mentally, emotionally, and physically, going through this very tense time?
Well, being kind, again, it still stands, and it's probably more necessary than ever. Remembering that the hardship, again, it's the pandemic. It's something that happens of this caliber once every 100 years. And when it happened last time, the Spanish flu, 1918, there was similar trajectory to what happened right now. 6 months using a mask became a political statement. 9 to 12 months, there was organized protest. If we can just step back and realize this is not going to last forever. All pandemics end. And it's unfortunate that we are dealing with a strain that requires 90%. And the vaccine, is it being done to target people individually? No, it is for the collective good of the community. And it's not a foreign concept. We have mandated vaccines in schools. Measles require a level of immunity coverage of 95%. And we've seen over the past few years in the United States where certain jurisdictions don't have that level, the measles comes back in outbreaks. So again, this is not a foreign concept. We apply it in many things where we need to balance between the individual right and freedom and the public good and the freedom and right of other people around the table. Like, as I mentioned, some people have the vaccine, have done everything they need, and they have the right to socialize in a safe environment. And they're asking for a mechanism that would not infringe on the privacy of others. And we've heard about the code bar and all these things. So again, back to your question, my advice is to do our best, to be kind, to understand the situation, to educate ourselves about the safety, efficacy of the vaccine, safety and efficacy of managing a pandemic, and at the same time educate ourselves about the other opinion and the right of other individuals. Like, I see some people who are raising their concern about, I don't want to be vaccinated. This is my body. It's my right. Absolutely. I would agree with this. And there's always a choice. So again, patience and self-education, self-learning will get us through this.
So you're basically, if I can summarize, you're saying every individual has the right to choose, as long as it doesn't put the larger group at risk.
Definitely. And even, Carol, like when people, there is vaccine and there is a passport. And if a person said, I don't want the vaccine and I don't want to use the passport, sure. This activity that entails going to the restaurant or watching a hockey game can be delayed until this pandemic is, 4 months or, 8 months or whatever it's going to be. So they still have the choice.
Yeah.
Nobody's saying everybody must be vaccinated.
Yeah. So that's a good point. You're indicating the choice is also to delay in timing for the individual who chooses not to be vaccinated to participate in other events. So that's also a choice as well. I wonder if we can talk a little bit about the children, just to move the topic to the children. 12 and up can be vaccinated, or within that 12th year. How much of a risk is it? As a parent who might be considering sending their children, what words can you share around what would happen to their child if they happen to catch COVID? Originally, COVID was certainly, we were concerned about those immunocompromised and the older people, but now we're concerned for the younger ones. Fill us in a bit.
Yeah, certainly. It has a few facets. One is the new variant. Other one is the vaccine and the measures in place in schools. The statement that COVID would affect older individuals more still stands, even with the Delta variant. The children seem to have way less severe complications or severe disease comparing to the older adults. It's affecting younger individuals who have seen people in their 40s on ventilators who otherwise been healthy. When you look at the relative complications in different ages, since many people who are older received the vaccine, the complications in this age group has went down versus the complications in the very young and the children remain the same. So relatively, we've seen increase, and we would see increase in the hospital, but truly the disease still would not affect the children in the same way it affects older individuals. So that's reassuring from one point. There is another layer of reassurance comes from the fact that although children under 12 are not receiving the vaccine, it's not licensed to receive it, everybody around them who can get the vaccine and got the vaccine is providing that layer of protection. Mm-hmm. If we look at the number of people vaccinated, 76%, 2 doses, that's 3/4 of the population. That means that much reduction in transmission has happened, and that will protect everybody, including the people who cannot receive the vaccine. The Delta variant is definitely higher, has higher level of transmission than other variants. So that this variable obviously is not on our side. But you go into the school and we have a practical application for the past year. There are many layers of protection. And sometimes, I get a call or an email from a parent or a teacher or a staff in the school saying, these two kids are not wearing a mask. And just we need to remember that this mask is one small layer of many other layers. The screening for symptoms before the kid leaves the home, the screening during the school day, anytime staff or a person, students recognize that there are symptoms, case and contact tracing in the community. Although it's in the community, it would really reduce the risk that transmission would happen in the school subsequently. And the case and contact tracing within the schools. Then you add to it this layer of vaccine, hand washing, and physical distancing. So again, it's augmenting the layers over each other. And if one is not there, the rest would still work, although they are invisible. The fact that 75% of the public had 2 doses or 76, that is excellent finding at this point. And again, there is still the effort, and we're not out of the woods yet, and we all need to go that extra layer extra step to ensure the vaccine goes up to 90%. At that time, we will have optimal protection. Yeah. And one final point on that, the studies about the safety of the vaccine in children under 12 is underway, and it's expected to be around New Year's or around that time that the approval will take place.
There is now a 3rd dose option that's coming forward that's targeted. And I'm wondering if you could speak to that and also speak to the comments, well, gee, didn't the first 2 work well enough?
Definitely good points. The vaccines that we have, Moderna and Pfizer, require 2 doses, and that generates immunity in most of the individuals. There's no vaccine that's 100%. Nevertheless, it is around 95% for the regular strains, around 88% for the Delta variant, which is excellent. But Carol, we know that immunity wanes down with times for these viruses. When is the cutoff for a person to require a 3rd dose? It is under study at this point. There are certain data from the States that would say around 8 months or so. But in Canada, we have not had the same decision for this. The 3rd dose, though, it is very indicated, will be very helpful for people who cannot build immunity as much as the regular individual. And you would see a reduction in immunity in older age, and you would see a reduction in immunity with conditions or treatments that reduce immunity, like cancer treatment or certain cancers, blood cancers. Yeah. So for this narrow group of our population, it is indicated, and that's what we're rolling right now, specifically in long-term care. Individuals in the community have control over their environment. They can, stay away from other people, versus in long-term care, it's a congregate setting. So that's where we're giving the 3rd dose to long-term care residents and the people with low immunity.
Yeah. And being able to offer that to boost their immunity at this time, as we're moving into the fall, also seems to make good sense, because they are the most vulnerable for sure. So we have a few minutes left in the program. Is there anything that you haven't mentioned that you'd like to bring forward for the public to be aware?
Yeah, there is in the school one added layer I didn't mention it. Grey Bruce Health Unit has been a pilot site or is going to start a pilot in targeted testing for school students who received the 2 dose and have been exposed to an outbreak or exposed to a case. So anytime somebody who's fully vaccinated is not going to be isolated from the school setting because they have received the vaccine. Nevertheless, there is this ability to provide self-testing, so the person would take their test, and we're going to be evaluating this program if there is added value and protection, and that could be possible. It could be replicated across the province. There are a few sites across the province, so that's just to reassure the parents that we're doing everything over and beyond to actually ensure the safety. And in this last minute that we have, again, the word that you mentioned, to be kind. Truly, any one of us could be frustrated for any reason, but now we have a pandemic that has spanned 18 months, and it took the livelihood of some businesses. It enabled people to see their loved ones, and now it is in a situation where we need even more vaccine, and obviously this is something sensitive for a number of our community or a group in our community that are very upset about this. Being kind, just looking at the whole situation and the whole pandemic, and knowing the hardship is not targeted to any individual. All of us are in this together. So being kind will just give us a bit more energy to do a bit more good for all of us.
As we're moving towards this part of getting through a pandemic, we want to be able to move through it and look back and have dignity, respect, and integrity with how we treat each other, even those with different perspectives. But it's a big demand on a time when we are just tired. And I think that's absolutely understandable, but it will take everyone to dig deep in their internal resources to be tolerant, for sure. But it's certainly a healthy thing to do, for sure. I want to commend you in the health unit, for sure, on how you've pivoted to try and get out to the people and not just ask people to come to the hub, which is a marvelous, innovative way of delivering vaccinations en masse. I mean, just like we've asked businesses to pivot, the health unit has displayed its ability to be adaptable right through this pandemic, and I'm sure ongoing as we move forward. I trust that you will take that to heart and also share that congratulations with all of the health unit. It has not been easy for you and the others as well, and I did want to certainly commend you for that. I also know that later today we will be interviewing one of the staff and a volunteer who did the vaccination hub and the volunteer experience. We're all in this together. And I think without the community and without the public health unit, I don't think we'd be as successful as we are today. Last words in the last minute. It's over to you, Dr. Arra.
Thank you, Carol. I've said this multiple times before, and I do mean it. The journalism in Grey Bruce has been one of the pillars of the response. The fact that you've taken the information, put it in the hand of the public in a timely way so they can make their decision to protect themselves, the family, and the community has saved lives. So thank you so much for your work on this. And as always, happy to be here again. Thank
you. And I trust that we will be speaking again with even more positive news. So please accept this as an invitation to come back on the program as we move through COVID-19. So thank you, Dr. Arra. And I also want to thank our viewing audience. Without you, this information would not be shared far and wide where we need it to.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
It's closing time, and you stayed out longer than you planned. So now you can't drive, and the buses have stopped running. You could always call your girlfriend